Hi, ladies and gentlemen. My name is Dr. Novoa. I'm a cosmetic OBGYN living and practicing in El Paso, Texas, the United States. I've created this PowerPoint presentation to empower you for you to have a better understanding of what effects your biological implants may be causing you. Specifically, we'll be talking about the autoimmune inflammatory syndrome induced by adjuvants, or ASIA, and the ASIA effect. Hopefully, through this presentation, you'll be able to better understand what you need to do as far as recognizing the signs, symptoms, and the general management that's necessary to be able to improve your health, and in some cases, actually remove the biological implants that are causing you harm. The reason that I'm presenting it in such a format is because, as many of you know, it has become very, very difficult for you to present your concerns to your doctor. Fundamentally, because the majority of doctors are completely clueless as to what your biological implants may be doing to your body. They're practically clueless as far as the ASIA effect is concerned. Therefore, I've created this PowerPoint presentation, which will be downloadable and also presented on a number of social formats. And I hope that they will be informative and educational and give you a fundamental understanding of what you need to do to improve your health. I hope you enjoy the presentation. Thank you so much for watching. Hello, ladies and gentlemen. Today is October the 1st, 2023, and we will be talking about ASIA, or the autoimmune inflammatory syndrome induced by adjuvants. The title of my presentation is The ABCs of Biological Implants and the ASIA Effect. So what is ASIA? If you were to do a Google search, you'd see probably that the continent of Asia would pop up in your Google search. So you have to be more specific. You have to type in ASIA and then syndrome or autoimmune disease. You can also type in ASIA and Schoenfeld syndrome for a better Google search. So ASIA is the acronym for the autoimmune inflammatory syndrome induced by adjuvants, where the autoimmune reaction or response is to one's own body producing inflammatory reactions to one's own cells. Induced means triggered or stimulated to occur. Adjuvant is a substance that stimulates an immune response to an antigen, and the antigen is a substance that causes the body to produce antibodies against it. So what is a syndrome? A syndrome is a group of medical signs and symptoms that are associated with one another and often with a specific condition, disease, or disorder. In the case of ASIA, it is described as a syndrome which is associated with an autoimmune condition which attacks the body's own cells, tissues, and organs. This response is considered localized versus systemic and intermittent versus chronic. ASIA was first described in 2011 by Dr. Schoenfeld and his associates, and it is associated with 4 conditions or categories, 3 of which are associated with vaccinations, and 1 of which is associated with breast implants. The first category we'll talk about today related to ASIA and vaccinations is the macrophagic myofasciitis syndrome, or MMF, which is a rare acquired skeletal muscle disease characterized by the infiltration of the connective and fibrous tissues of the muscle by macrophages, which are stimulated by the aluminum salts from the previous site where the vaccinations were given. So the vaccination has aluminum in it, and this stimulates macrophages to attack muscular tissue from the needle point and the incision site itself. The next category is post-vaccination phenomenon known as PVP, and this is where there's a production of autoantibodies and autoimmune responses to vaccination ingredients, most commonly aluminum adjuvants. Gulf War syndrome, or GWS, is a term used to describe a cluster of chronic medical problems that affect veterans of the 1990-91 Persian Gulf Wars. The cause is believed to be related to exposure to environmental and chemical agents during the war. One of the adjuvants appears to be squalene hydrocarbon used in vaccinations required prior to the deployment of military personnel to the Gulf Wars. Siliconosis. Silicone is an inert material which has been used for over 50 years in biological implants. It is an adjuvant that enhances the immune response, and it also enhances an immune reactivity by its reactions to components of connective tissue. The most popular type of implant, biological implant, and breast implant happens to be silicone implants. However, the Asia effect is associated with breast implant illness. So what are the classic constitutional manifestations of Asia? Number one, you're exposed to an adjuvant which induces a foreign body reaction. And these classical constitutional manifestations include muscle aches and pain, joint pain, chronic fatigue, cognitive and neurological disturbances and disabilities, and dry mouth. So what we have learned is not everyone responds the same way to an adjuvant. An exposure to an adjuvant triggers, stimulates, or induces an adverse autoimmune response in a genetically susceptible or sensitive individual of the general population. The classic constitutional manifestations may appear as nonspecific findings and overlooked as being caused by Asia by your doctor. So now we move on to Asia 2023, or what I call Asia 2.0. We understand that an adjuvant induces an adverse autoimmune response in a genetically predisposed individual, but that adjuvant is found in the environment as the cause and not inherent to the individual, or not inherent as a genetic flaw. So here we look at a diagram describing Asia 2011, also known as Schoenfeld syndrome. On the left-hand side, we see vaccinations and its three subcategories, which include Gulf War syndrome, macrophagic myofasciitis, and post-vaccination phenomenon. And on the right-hand side, we see siliconosis associated with breast implants. In the Asia 2023 version, or Asia 2.0, we see how much more of a better understanding we have of how Asia affects everybody throughout the world as far as an environmental influence. On the left-hand side, you have biological, naturally occurring vectors such as bacteria and viruses such as COVID-19. And then you have man-made vectors, which include the Asia 2011 vaccinations. And also at the bottom, we have long post-COVID vaccination syndrome. And then we have biological implants in the middle. That's what we're going to be talking about today, are the biological implants. In the Gulf War syndrome, for non-biological, the exposure of our military personnel in the Persian Gulf, they were exposed to chemicals, heavy metals, pollutants, and solvents and toxins. That's where that effect is also noted under the umbrella of Asia. And here's where, in this diagram, we see the importance or the effect of biological implants. You have external versus internal, temporary versus permanent. We're going to focus in on the right-hand side where we're talking about permanent implants, such as the breast implants, dental implants, the eShore permanent sterilization device, Felshi clips, Hulka clips, mesh, and surgical clips. This is the foundation of the problem related to the majority of men and women in the United States with the Asia effect and biological implants. So I like to describe biological implants as a subcategory of Asia as the autoimmune inflammatory syndrome induced by biological implant adjuvants, or ASIBIA. So that basically these are associated or the cause of implant illness. There are over 100 symptoms. They can affect all organ systems. They can be local and systemic. They can cause intermittent issues, flare-ups. They can go into remission, or they can be chronic. So biological implants also have an effect with associated syndromes. They can be associated with antiphospholipid antibody syndrome, breast implant illness, chronic pain syndrome, chronic fatigue syndrome, fibromyalgia, irritable bowel syndrome, Raynaud's syndrome, systemic nickel allergy syndrome, and Sjogren's syndrome, just to name a few. The symptoms associated with ASIA and biological implants include anxiety and post-traumatic stress syndrome. Cognitive changes most commonly associated are brain fog and memory losses, dental caries and tooth loss, GI symptoms, hair loss, skin sensitivity and rashes, sight-oriented pain and effect, and weight loss or weight gain. ASIA can cause a worsening of conditions that already exist for the patient, such as it can worsen depression and PTSD, diabetes, hypertension, fibromyalgia, lupus, narcolepsy, rheumatoid arthritis, and thyroid conditions such as Hashimoto's thyroiditis. One of the most important things to understand related to the management of ASIA is that it's so difficult to confirm that ASIA exists. There are no specific tests to confirm ASIA. However, there are also no tests to deny that ASIA or biological implants are the cause of symptoms. Therefore, a doctor should not tell you that your implants are not the cause of your condition because there's no test to confirm that that is true. I'm often asked, what screening tests can I have done to maybe find out if I do have ASIA? These include a laundry list of tests that can be done, including the anti-nuclear antibody test, antiphospholipid antibody panel, C-reactive protein, immunoresponse factors. Some tissue can be extracted from the site to look for macrophages and for giant cells. The lupus panel can be ordered. The presence of autoantibodies to include the human leukocyte antigen complexes and their subcategories, as well as CCL11 might be helpful. Rheumatoid factor, Sjogren's syndrome panel, and the thyroid stimulating hormone panel. Screening tests for hypersensitivity to metals, chemicals, environmental toxins, and molds would be a good idea. This is known as the MELISSA test or the Memory Lymphocyte Immunostimulation Assay. And when you're looking for our nickel, mercury, titanium, beryllium, and nictinol sensitivity. However, MELISSA is not available in the United States. The next best test that is available in the United States would be the orthopedic analysis, which is, and I've included here their website at www.orthopedicanalysis.com. The management of an ASIA biological effect is rather limited if you're only going to be using medications, and it's usually the management of symptoms in order to improve symptoms as if it was an autoimmune disorder, specifically the use of pain medication, anti-anxiety medication, antidepressants, and steroid therapy. Whenever possible, the best management and permanent management of an ASIA-associated biological implant condition is going to be the surgical removal of the implant and its affected adjacent tissue. When you remove the implant, what we have seen is that there's general improvement or resolution of symptoms in approximately 80% of patients. However, there is an inherent risk of continued symptoms which appears to be greater in women than in men due to the predisposition of autoimmune diseases in women. Since ASIA is extremely complex, it only makes sense that a team of doctors work with you to try to help you with your condition. Specifically for the immune response, we're looking at an immunologist, an allergist, or rheumatologist. Interventional radiology is so important as someone that can guide your primary surgeon for the surgical removal of an implant. They are the ones that can give non-invasive second opinion, hands-on approach to taking implants out while the patient is still in the OR. We're looking at pain management. These implants can cause a variety of different types of pain syndromes. Psychiatry is so important because these effects cause anxiety, increased depression, and post-traumatic stress disorder, or worsening conditions of any of these already established conditions. And then you have to deal with your specialist, the doctor that is dealing with the implant or that had put it in. Number one, if you have an implant that's in your heart, the cardiologist. If you have something that's affecting your that needs surgical intervention of the brain, neurology. Symptoms or problems with your GI tract, gastroenterology. And for E-Shore, Felshie clips, mesh, and as such, we're looking at obstetrics and gynecology. In conclusion, all biological implants have the potential of causing catastrophic problems in susceptible individuals. There are no tests confirming that your implants are not causing you adverse effects. When possible, Asia-associated symptoms are best managed by complete removal of the implant and associated tissues. Your doctors are not experts, only students on the subject of Asia. This completes my presentation for today. Thank you so much for watching.